Dr. Peter Buecker, welcome to the Lindsay Elmore Show.
Thank you. Thanks for having me.
Teach us a little bit about what is mind-body medicine. You had a medical practice as an orthopedic surgeon and then just kind of deviated into left field and said, I want to learn something completely different. And you got a PhD in this subject, which means that we have a lot of guests who I think come across as and freely admittedly so, come across as a little bit woo-woo about how mind-body medicine works. But if you're getting a PhD in this, there has to be a ton of research and a ton of well-validated understanding of how our mind and our thought processes impact our body's ability to stay well. Talk to us about that.
Yeah, it's a very deep subject, of course, but I'll do my best here and hopefully do it justice. First and foremost, I personally come from an orientation that we hear a lot of this term, the mind-body connection, the connection of mind and body. And I sort of challenge that and say, I believe that the mind and body are one and the same. I don't really see it as something that's connected so much as different expressions. If I'm sort of imagining that I'm in pain, for instance, I know there's some physical pain, but my experience of the pain very much also has to do with how I'm thinking and feeling about the pain. And we know that then also affects, the severity of the pain that I experience. So they really are all kind of one and the same as part of the totality of the experience. And so in some ways, I would say that really all medicine is mind-body medicine to a large degree. But really where the rubber hits the road, I think, is how, it's exactly that. It's how the way we think about things, how we perceive things, how maybe the way we react to certain stimuli in our lives. The way that we process emotions, of course, is a very, very big one. How we process stress. And when I say stress, which is a big, big focus of mine in the mind-body medicine studies that I did. But when I talk about stress, I'm not so much talking about, feeling stressed or things in our lives that we say, oh, I'm stressed, or, this time crunch, or the kids got to be here, or whatever. What I'm talking about really is the physiology of stress, which really, it really impacts every system of the body. Literally from the way we think about things, how we react mentally, down to the way we clot blood and everything in between, literally. So it's really, when I went to mind-body medicine, it's because, as an orthopedic surgeon, if you think about it, like what we do is we sit in an office and listen to people talk about pain all day. Like, that's it. You don't go see your orthopedic surgeon to tell them how great you're feeling. You go because something's bothering you. And those who do get better after surgery or injuries or whatever stop coming. So you really are left with people who continue to be in pain and having problems. And I was kind of on my own personal healing journey and going, sort of processing a lot of painful parts of my life and my past, and sort of, getting my mental and emotional system straight. And then just seeing it every day in my clinic, people coming in pain with inflammation, struggling to get back to some sense of normalcy after an injury or a surgery, and saying, okay, there's got to be something more I can do, beyond a pill, an injection, or procedure. There's got to be something else I can do to help these people really reacclimate back to life. And if you really want to get even more granular, where the journey I think really started was that my specialty in orthopedic surgery was oncology. So I was dealing with people with a lot of, cancer related issues or tumor, benign disease, whatever. But what I noticed very early on and just started sparking these questions was, why do some people with very minimal disease have a really hard time in that process? And why do some people with terrible disease, overwhelming disease, float through it? They stay very much in the zone. They stay very positive. Not that we should be falsely positive, but they're genuinely sort of taking it in stride and going through the process with a great deal of resilience. So what's the difference? What's the difference between those two crowds? And so then that was really the origin point. But then the more I started paying attention to it, of course, the more I just started seeing it everywhere with, like I said, pain and recovery, even proneness to problems and injury, even to the point of people saying something bad's going to happen, it's going to happen to me, and then it does, right? And they keep having complication after complication after complication, new injury, new problem after new problem. So I just said there's got to be a lot to this. The way that we think and process really does impact our physical health. And of course, to your point, and I've gone on and on and on here, but to your point, to bring it home here is to say, yeah, there is a lot of, and today more so than 10 years ago when I started that journey, there is a lot of medical literature and evidence supporting all of those pieces.